Hi, myself Dr. Vivek Sasindran and welcome to another episode of ENT Talks. Today I would be talking about tracheostomy or tracheotomy. So what exactly is tracheostomy? Tracheostomy by definition is a surgical opening that is made in the anterior wall of the trachea or the windpipe. Now there are umpteen indications for performing a tracheostomy. Now you could roughly classify them as emergency indications or elective indications. So emergency indication is probably when you have sudden onset of respiratory distress. It could be due to umpteen causes. It could be probably a bilateral vocal cord palsy, or it could be secondary to some kind of oncological cause like a large tumor that is obstructing the airway. So in those kind of scenarios, in order to secure the airway, we perform what is called as an emergency tracheostomy. Now, elective tracheostomy, you have far more indications. The commonest being prolonged ventilation. A patient in the ICU who requires ventilation for a prolonged period of time would be a candidate for a tracheostomy. Or if the patient has respiratory paralysis, where the patient is not breathing very well, so in order to provide assistance, you require mechanical ventilation. Could also be done to prevent the lower respiratory tract. For example, if the patient has aspiration is nothing but when the patient eats or drinks, if there is the food particles or if the liquid kind of seeps down into the airway, that could lead to aspiration in the long run. So in order to protect the airway, you could perform a tracheostomy. So there are umpteen indications. Similarly, if the patient has a very bad chest, for example, a patient who has a chronic obstructive pulmonary disease. Now, if the chest is bad, there are a lot of secretions in the chest. If the patient is not able to bring out the secretions or if the cough is not effective, so we can do suctioning through this tracheostomy. So it helps in faster recovery of the chest. So these are some of the indications of tracheostomy. For more information on tracheostomy, please continue watching our videos. Thank you.